Day 3 Arab Health. We are here on the main stage at M42, and we've had a fantastic first 2 days of back-to-back programming. I think you'll agree that this has been one of the most popular booths here at Arab Health, if not the most popular. And today and tomorrow we continue with high-level panel discussions, firesides and thought-provoking presentations. Now, you've heard a lot from me. I'm Mandeep, your MC for these 4 days, but I want to bring on stage someone to give you a bit more of an insight in terms of exactly why we've been doing what we've been doing. So without further ado, may I please introduce Bonnie Laurie, the Executive Director, Group Marketing and Communications, M42. Give Bonnie a big, big round of applause.
Thank you so much. Appreciate it. Thank you, Mandeep.
Bonnie, we started on day 1 by being on stage and doing a massive big kickoff. I'm glad I'm on stage with you again. This thought leadership platform, tell me your insight about why you've wanted to create this year.
Thank you so much. And thank you everyone for being here. We won't take up too much of your time. Thought leadership is at the heart of what M42 is all about, leading the way in health tech, leading the way in prevention, precision, personalization, and the best way to do that is to share knowledge, bring everyone together. And we have so many amazing people within the network, and then those that are our friends, like we had yesterday, huge collaboration with Microsoft, with the Broad Institute, with so many.
And institutes here like the Health Point and Mubadala Health,
Exactly.
so many organizations. And speaking of amazing collaborations, I know you want to do the honors of introducing the next moderator on stage.
Thank you so much. I want to introduce Benjamin Schroeder. And I'd like everyone to put their hands together for Ben. He is at the heart of all of our programming.
Grab a mic,
over the 4 days. Thank you so much, Ben.
Thank you so much. Good.
This has been amazing, the organization. I work across so many events and conferences here in the UAE, but what you and your team have managed to create has been fantastic. Ben, thought leadership, it really is a future, isn't it?
It is definitely the future. And I say what we did here is moving from propaganda to thought leadership. We're not talking about products and so on, but really talking about the value we want to create and bringing the smartest people together. I think that's really important. Independent if they're with the company or outside the company, but really to look at the bigger picture, not just health, but not just healthcare, but health, not just patients, but people, and to really make it the overarching thing we want to achieve.
Absolutely, and I have to say that Ben and Bonnie and your whole team, you have achieved this. We really have got that key message that's been shared. Let's get a photo on stage, and then we're going to head off and allow you to introduce your panelists for the next session. So we'll just get a little video. Ladies and gentlemen, please give it up for Bonnie and Ben. Thank you so much. And Ben, please do introduce your panelists and take over the stage. Thank you.
Fantastic. Thank you so much. Good. I would like to ask Dr. Andrew and Dr. Whale, both medical directors, to join me here on stage. And for those of us who have followed M42 a little bit, we've been very strong on the trilemma we have between health and environment. And what we want to discuss today is really what is the impact of environment on health. And this is something which we will discuss, and not to forget the topic of technology. So I'm very happy to have, on the one side, 2 doctors here, but very much on the technical side as well. So let's have a good conversation here. And I don't know how many, I looked into the last statistics, and if we talk about the environment, we talk about air pollution. Who of you in the audience, what are your guesses, right? Dubai, in the global statistics. Which number is Dubai? Any guess? Top? The most polluting. So the good news is we are not in the top 10, which is a good. If you look into the list from the best country, from the best city, we are at, from 2019, at number 220 something, right? So there's a lot to do, but we will also talk about air pollution and the topics of what is actually man-made, right? And what is actually due to the environment we live here due to the desert. So before we get started, I would like to have a look at a small trailer from the World Health Organization, which gives us some insights into the environmental factors.
Air pollution It lurks all around us, preying on the young and old. It slips unnoticed past your defenses and assaults your lungs, heart, and brain. Its deadliest weapons are invisible, poisonous particles that can be as small as a molecule. With every breath, they break through your lungs' protective barriers. There, they trigger inflammation as your system tries desperately to fight back. But these tiny intruders penetrate those defenses, lodging toxic compounds even deeper, sowing the seeds of cancer. They slide straight into your bloodstream, sabotaging your entire body. They inflame and constrict your blood vessels, increasing blood pressure until, one day, causing a stroke. The particle prowlers dislodge fatty plaque that may have built up from your diet. They weave clots that can be deadly blockers of blood flow to your heart or brain. With each new case of heart attack, stroke, lung disease, or cancer, air pollution adds another life to its hit list. Let's stop this invisible killer.
Quite a tough video to start the conversation with. The good news is that we also have a solution, and we will talk about that. Dr. Andrew, you actually came up with the video, and you're actually from Australia, but you've lived pretty much around the globe. Tell us something from your perspective, also as a medical doctor. What is the impact of what we've just seen on health?
All right, thank you, everyone. Air pollution is a killer. They say it kills 7 million people a year. If you think of COVID, that killed 7 million people over 4 years. And air pollution does that every year. So it is a killer. Now, I've seen it myself. I've lived in Jakarta, very polluted city, in China, where you can't see across the road. And I've lived in Qatar and here, and Vietnam, many, many polluted cities. But what I see it most is in my workers. So I'm from Australia, and I see a lot of coal workers. Now, coal workers are exposed to silica. Sand is silica. Bricks, cement, all those stuff, it's all got silica in it. And when you're in a coal mine, you breathe in that black silica, and you get black lung, or silicosis. Now, the interesting thing, these people have been getting more and more silicosis because the machines are getting better and better at digging out more coal, and they're making more air pollution. Now, we have a level, and we try to keep people below that level. When there's a sandstorm here, that level is above what I have in my coal mines. So I would stop people from working in the coal mine if the levels of air pollution were as high as they are here in a sandstorm. And so I think the other thing I'd just like to add is kitchen bench tops. They're made out of, the new bench tops called artificial stone. They're basically made out of silica, 98% silica. And we've had an epidemic of silicosis, so people breathing in the sand, and it's actually now over 500 cases of silicosis in workers. So when people think that air pollution is nothing to worry about, I say no. Look, I've seen people die from it. I've got people waiting for a lung transplant because of air pollution. I've got people who have got cancer because they had a combination of silica and diesel fumes. Coal miners get that all the time. This is actually really dangerous, and no one even thinks about it. It's just, it doesn't seem to be as big an issue as it should be.
Thank you so much. So now that we have described the problem, I think we need to also come up with the solution and what can we do, right? And I think, Dr. Whale, you are one of the thought leaders, I think, when it comes to environmental testing, really, and we've seen each other at COP28. You've had numerous panels here this week. So tell us something. What is your approach, right? What are you doing? And how can it help, right? How can you give governments solutions to really support this transition?
Thank you very much, Ben. So I think the first step to finding a solution is defining the problem and understanding what the problem is. And a lot of the focus in healthcare has always been, over at least the last 100 years, focused on the end event. We treat cancer after it happens. You treat cancer by taking a biopsy, then you subject your patient to chemotherapy, radiotherapy, and a bit of surgery. Although the science itself starts a little bit more that anyone who's done biology in high school gets taught about homeostasis, the maintenance of a constant internal environment. And before you do that, you also remember that if someone punches you, you get inflammation. So exposure is always the event that leads to the consequence. So if you're not exposed to carcinogenics, your oncogenes, which is what we screen for at G42 with the EGP, wouldn't necessarily give you cancer. We know this from P53 gene that causes squamous cell cancer in the mouth. If you're not exposed to the virus, you don't get squamous cell carcinoma. And the way we've changed our lives over the last 50 to 60 years with urbanization, with a congregation like the one we live in here, with I'd probably say 60 to 70,000 people in this room today, is not necessarily how our bodies evolved. So exactly in the same way that we've developed this synthetic environment that we live in, we need to find a synthetic solution that mitigates the risk of exposure. We can't do much about the sandstorms at the moment outside because that's an event beyond our capacity. But we can certainly look at the ventilation. We can certainly measure the ppms in a room like this. We can certainly ensure that your HEPA filters are clear. You can certainly ensure that they're installed properly. You can certainly ensure that you have measures to have maintenance looking at them all of the time. So I think the key is, first, our realization that we actually have to look at this, and governments, in terms of return on investment, looking at it downstream is actually a lot less cost effective than trying to mitigate the risk early on, especially with all the changes that we can see coming from global warming to all of the other events, which mean we would need more cooling and more congregation inside buildings like the one we're in today.
Good, thank you so much. We have it written over there, or prevention, not just cure, right? So tell us what would be a practical thing to really prevent this, right? How can we reduce air pollution, right? And how can we have this alert, or I don't know how this would work. Dr. Andre,
Yeah, another group I take care of, firefighters. Firefighters are breathing in smoke. Everybody knows cigarettes are bad for you. This is what firefighters do. So we have to take care of them by making them wear masks with filters in them. You know, we have N95 masks in healthcare. You basically can actually filter out all that smoke, or you make them scuba, SCBA, self-contained breathing apparatus. So you can actually reduce the risk for firefighters. We see firefighters, they still get cancers because they're exposed to smoke and all the products of combustion, but we reduce that risk by making them wear masks. Unfortunately, they can't wear masks for 3 or 4 days, and if you go to a fire, when you're fighting the fire and there's lots of flames, that you wear your mask, but then a day later it's still smouldering, but you're going around and you can't wear your mask for 4 days straight. So that's why they still get cancer. But if you do risks, we work in hospitals. HEPA filters, they stop COVID. They stop basically us getting infected. So HEPA filters are really great. We're very lucky. Air outside's terrible, but air where we work is great. So I wouldn't expect anybody of healthcare workers to have really bad quality air in the places they work. They should have good air quality air, and Whale can test it to make sure it's good quality.
Thank you so much. So testing, I think, is really important. So there is not just air, right? And I want to go a little bit into the topic you outlined yesterday. I won't forget it the first time we met at COP28. Water and wastewater, right? What we all use every day, right? When we go to the washroom, or what we drink all the time. And I know that Dr. Andrew wants to talk about what we drink. So I think we start with you again, Dr. Andrew. Outline a little bit drinking water. Is it a glass bottle? Is it a plastic bottle? Does it matter? What do you think? Does it matter?
Yeah, and this is really interesting as well. Can you hear me? Yeah. So basically, it's actually safer to drink tap water, go to the toilet and fill up your bottle with tap water than it is to be drinking this. There's actually microplastics, there's all sorts of plastics in all our environment, and actually the water treatment plants take a lot of those microplastics out. So it's better to drink tap water than it is from the natural springs, because they're often contaminated.
But this is a glass bottle.
And the glass bottles, unfortunately, they're filled up with water that often have microplastics in it. So they're not contaminated by the glass bottle, but the microplastics are already there. And Whale can test that and prove that for you. And it's really interesting. I've got 5 boys, and plastics, the BPAs, all that, they're called endocrine disruptors. So they can basically change your sort of sexual characteristics, reducing sperm count. It's associated with all sorts of changes. I don't want my boys to have their endocrine system disrupted. I think it's actually not something that we talk about, but endometriosis is often associated with endocrine disruptors. Period pains, there's so many issues, health issues that are created by these microplastics. And again, it's not talked about. Everybody here is drinking bottled water, giving it to their children. I got in trouble because I wouldn't give my children bottled water to take to sport. The mothers were looking at me saying, "You're a bad dad." I was saying, "No, go drink the tap water." And they were looking at me to say, you're bad. And I'm thinking, no. And to be honest, now the mothers are concerned about BPA, and they're getting BPA-free bottles, but they still want to give water bottles to them.
That's very interesting, quite disruptive. I think we can take this conversation home to discuss at the dinner table with the family. Now let's talk about the solution. And I know, Dr. Will, you have a high tech, right? What people dream of, right? Your labs, and you have AI, you have supercomputers you're working with. And you are also analyzing the water, wastewater, I think pretty much unique in the world, the labs you have and what you've set up here for Abu Dhabi and the bigger, wider region. Tell us something about it, and please also come to the positive point. What can we read out of this, and what could be steps to support?
So I think the first thing that we've sort of realized is we tend to look at things very narrowly in healthcare, whereby we address one problem at a time, not taking into consideration the butterfly effects and the multivariate relationship between things. So, for example, the mention of microplastics that Andrew here says, it's a complex problem in that if you don't have the containers to put the water, then you won't drink water. So you might end up with renal failure or dehydration. So which of the two is the worst of the two evils? However, there's always consequences to all of that. So what we're trying to establish is we're looking at all of these molecules in interaction with each other. We know that there are certain bacteria that are very good at digesting microplastics. There are new problems that a lot of people wouldn't be aware of, called the PFAs and the PFCs, the fluorinated alkaloids, which are the never ending chemicals that you can't just get rid of them. It's close to impossible. And they're accumulating in our fish, they're accumulating in our fruits, they're accumulating in our vegetables. And it's very difficult to get. But what we don't understand is the effectors. We're pretty certain that certain solutions exist in nature. However, we need to understand. We have the other problems of multi-drug resistance, but we also understand that bugs evolve with bugs, and they compete with each other, so solutions will be found in these very harsh environments.
Give us some examples, like some practical examples, what you're measuring and what you're...
So one of the biggest problems at the moment, expected and anticipated to cause mortality by 2050, much more than cancer, is death associated with antimicrobial resistance. Superbugs is the word that people commonly use. And at the moment in hospitals and in countries, including here in the Middle East, the rates are going phenomenally high. We have patients in hospitals for whom we can't find antibiotics to treat them. However, since the 1930s in the ex-USSR, in Georgia specifically, there's been a lot of research based on something called phages. And phages are small viruses that actually kill bacteria. They've been used successfully, that the project went down. You can find phages in your lakes, in your rivers, in your oceans, and in your wastewater. So one project that we're looking at with, I can't see Javier is standing there at the back. We're looking at phages in the wastewater, which effectively we're identifying very specific viruses that target very specific bacteria that are safe to use in humans. We've already submitted one paper, I think, Javier, and we've presented our data in the US and here, and it's part of the work that we're doing, looking at all of these natural environments to find solutions to problems that maybe we have created ourselves.
So, Dr. Andrew, how do you take that to the next level? What are you as a medical director, what are you doing about it, and how can you support?
Yeah, look, I think these environmental issues, often you'll go to a doctor with a heart attack. He doesn't ask you about, were you exposed to, he might ask you about smoking, but he doesn't ask you about the air pollution. He doesn't ask you about what foods you're eating and what exposures do you have. So as an occupational physician, he was talking about sewage. I think of sewage workers, because they get all these sewage workers and they get these horrible infections in their lungs, very hard to treat. We have to vaccinate them with Hep A and Hep B, and because they're exposed to all these nasty bacteria. So I'm always thinking about the environment and how to reduce the risk in the environment. If you come in with cancer, you know, doctors often don't ask what job you're doing. First thing I say, what do you do? Oil and gas worker, I think benzene. Has he been exposed to benzene? And a lot of doctors don't think like that. There's actually a real need for us to start thinking about what is causing the cancers, what is causing the heart attacks, what's causing the strokes, the cognitive decline. There's so much cognitive decline, and it's a real issue. And I'm sure that the complex chemicals we're eating and drinking are contributing to the large amount of dementia in our community. There's a lot to do, but we need a lot more research and we need a lot more testing.
I think, Dr. Andrew, you have also analyzed a little bit, as we don't have that much food which is really coming locally here, right? And you have looked at some of the journeys, some of the stuff we eat every day is taking. So tell us something about it and what kind of risk, and what would you recommend to us?
So the other thing, I love my career, I'm sorry about this, occupational medicine, we test a lot of heavy metals. So fish, for instance, now we're seeing in a lot of fish collected in many areas contaminated by mercury. You know, they're actually in some herbs in India, they're actually adding lead to the herbs to make them look more red. So chili powder, curcumin, if you put lead in, it makes it more yellow. So some of the herbs that you're buying from overseas could be contaminated with lead. Heavy metals are great because we can test them. Whale can do all the testing on heavy metals. He can tell you what your levels are. High lead levels cause, you know, problems with your brain, peripheral neuropathy, wrist drop. It's actually heavy metals is a big issue, and you know, it's also something that we've actually acted on. We used to have lead in paint, lead in petrol. We've taken it out. So this is why when you can test, you can actually make a difference. That's made a lot of less lead poisoning in the world. Likewise with mercury, we can test for mercury, and we can actually do it. PFAS he talked about. Even though all the firefighters use this stuff that contaminates, that puts out fires, and it actually gets into your blood. You can't actually get rid of it. It's a forever chemical, but you can bleed them every month. Go and give your blood every couple of months, and that actually reduces the level in your body. That's the only way you can get rid of PFAS from your body. But no one knows about any of this. I feel sometimes like I'm talking to people who have never heard about PFAS, who have never heard about mercury in fish, and it surprises me.
Well, you're lucky because Dr. Well has, right?
Yes, he has.
And I think one of the big partnerships you have is Ocean X as well. And you have done quite some water analysis, also marine environments. So talk us through a little bit what you're doing with Ocean X and what are the outcomes from your analysis.
A lot of the work we do at M42 is supporting decision makers with regards to directions and predictions to what will happen. The oceans play a major role in everything we do, from them being a global supply chain of foods to transport to a lot of economy building for a lot of us, to the transport of your food, to the goods that we get here. So understanding the oceans, which we know a lot less than we know about, you know, the space at the moment, we started a very ambitious project with the environmental agency in Abu Dhabi. We developed some methods to study DNA directly from the sea, whereby we try and estimate the populations of fish and the species that we find. We are then continued this collaboration with Ocean X. For those of you who might not know it, it's the same ship that they filmed Our Blue Planet in, narrated by Richard Attenborough. So we've got a team member at this minute working with them somewhere in the Indian Ocean, trying to map the DNA of the populations of the sea. And the whole cycle goes around. What we produce may end up in the oceans, affecting the fish that comes back into our bodies, or affecting the supply chains, or there's a lot of oil drilling in the seas, there's a lot of gas that we're letting out. And our purpose here is to just simply attenuate the risks and enable and facilitate decision makers. We will have to make use of these resources, and our role here is just simply to facilitate and make it easier for decision makers to be able to do that sustainably and safely, in particular with our rising ages and rising populations.
Excellent, thank you so much. Do we have audience questions for our experts? There's one question.
Hello, I'm Joelle Farha. I'm a food safety expert.
Can you put your hand a little up? The microphone.
Here? Okay. My name is Joelle. I'm a Lebanese clinical dietitian and food safety expert. I just noticed that you were saying almost all the food here in the UAE is imported. But as far as I know, that we have international food standards. So taking that into consideration, why should that lead to let's say, heavy metals like intoxication? Or would it be like a best solution like to go toward bio-food? This is my question.
Good question. I was talking to a guy who actually grows food in plates because he thinks he can make fish safer without mercury if you grow it in a petri dish. Now maybe he can. There'll be less mercury. He can test it and show that there's less mercury. Something like PFAS. I live in Australia. Actually, you have cows who are drinking PFAS-contaminated water. Now it's not tested. It's not tested. You can go buy a really expensive steak of Angus, and it won't be tested for PFAS. And PFOA is actually cancerous. Now I think one day they'll start testing it, but they're not testing it yet because people don't know about it. Heavy metals can be tested, but the herbs and the spices, if they're not FDA approved, say somewhere in America, you can import those and they're not tested for heavy metals. So you will find that there's a lot of stuff imported that has not had testing. And you can't test everything. You can only test sort of a sample of it and hope that everything else is the same. So I know that some beef in Australia is safe, it's great. But I know there's a couple of places which are contaminated with PFAS and I wouldn't buy steak from there. But no one else knows it. Sorry.
Thank you. Do we have further questions? Good. 2 minutes left. Thank you so much, gentlemen. I think one of the important things is transparency. I think this we see from both sides. On the one side, to analyze, on the other side, also what needs to be done. So what would your recommendation be for the people here, or also for governments, right? Where do they need to invest in when it comes to really supporting more the idea of prevention?
So I think the first step is accepting that we do have a problem, and trying to brush it under the carpet isn't going to work. Populations are increasing, these problems are increasing, and we need to have a standard whereby it equates everything in the ability to have evidence to support any decision making. It cannot be haphazard, based on emotion. It has to be justified, tested, proven. The assumption that A is very bad for us and hence we need to go and eat B or import from B is a very difficult decision, in particular in the world we live in now with a lot of changes that happen too quick. We're not trying to scaremonger, we're just trying to facilitate the decision making, and it's a balance. Do we need to import this vegetable or that vegetable to ensure that our populations have a better standard of living and a better health for the time that they are with us on this earth.
Thank you so much, Dr. Well. Dr. Andrew, over to you.
Yeah, look, I think we need more education about environmental issues, but let's just take what I do. I've got a HEPA filter in my hospital, great, good air there. I've got a HEPA filter at home too. Simple thing, you can go to buy it from Carrefour or Lulu's, anywhere. They're around, you can improve your air quality at home, and I've actually even got 2 little HEPA filters for my car. I'm a bit of I have asthma, so I worry about air quality. The other thing I do is, like Ben, I have a metal water bottle. And if I go to a garage, I had to stop at a garage, and you look at all those drinks, none of them, they either got high sugar or they've got plastics. Just go to the toilet and fill up your water bottle. It's the safest thing to do. And then with your food, it is important to know about food, what foods are at risk. You have to read about it. You have to know which foods to avoid. The sort of higher oil fishes have high levels of mercury. You limit yourself. So if you're pregnant, you don't eat too much fish. But you have to learn about it. You have to read. And doctors also have to learn more about it too. And I think there's a whole issue about education and educating our doctors and the public so that they're aware of all these issues.
Thank you so much, gentlemen. I hope you enjoyed the session as much as I did. I definitely learned something, so something I'll take home. Dr. Andrew, Medical Director, Capital Health Screening Center, thank you so much. Dr. Whale, Medical Director, M42, thank you so much for joining us here on stage.
Thank you very much.
Thank you.